Heather King is an associate professor of anesthesiology and perioperative pain medicine at Stanford. She serves as the director of our pain psychology fellowship and developed and now runs the medical fellowship and wellness program. In her clinical roles, she specializes in the development of novel interdisciplinary treatments, such as cognitive behavioral therapy and acceptance and commitment therapy. She also performs biofeedback and hypnosis for patients. She's a master CBT trainer for multiple NIH grants and serves as the director of behavioral services for a large PCORI-funded Stanford grant called Empower. On a personal note, Dr. King is just an incredible colleague, clinician, friend, and it's really just a pleasure to work with her in the pain management clinic at Stanford. And I'm so happy that she's here today, sharing with us some tips for combating stress, which I think we've all had to deal with in the past, but especially in the past year. So thank you, Dr. King, for being with us.
Oh, thank you, Dr. Tawfik. I feel the same. I feel so thankful to get to work with Viv and just to consider her as a friend as well. So, and I know I'm here today because of you, Dr. Tawfik. So thank you for inviting me. I'm really looking forward to introducing some tips on how to manage stress. This has been a particularly difficult year. And, I think one of the things that we are not great at is really taking care of ourselves. We're really good at taking care of others. So I hope that today's talk will be helpful. Advance this. I have no financial, I have nothing to disclose, and I'm not discussing any medications. This past year, I think, could be best described as us being caught in the storm. With dealing with any type of a difficult situation, what we always do is we look to what have we done in the past? How have we managed this in the past? And quite honestly, with the pandemic, we didn't have that reference point of this is what I did last time I dealt with this, because this was the first for many of us. So, the fact that it's ambiguous, it was new and novel and unpredictable, I think made it even more challenging because there was a lot of fear, understandably so, a lot of fear associated with dealing with this. And, whenever we're dealing with difficult situations, difficult negative emotions show up. And many of us have a hard time with our negative emotions. We want to change them, ignore them, suppress them, distract from them. We have a really hard time sitting with how we feel. And so I asked some of my colleagues to come up with a list of emotions that they have dealt with during the pandemic. And this was the list that they came up with. I would love for those of you who feel comfortable to share in the chat box if there's anything that came up for you, any different emotions that came up that aren't listed here. This is certainly not an exhaustive list. But I think for many of us, feeling anxiety and guilt. I know for myself, guilt was a big part of my experience because my colleagues who are frontline workers, were putting themselves at risk to provide patient care. And I did have the opportunity to work from home. And so, although I was incredibly grateful for that, there was certainly a level of guilt of why do I get to do this when my colleagues are risking themselves to provide exceptional patient care. And then helplessness, not being able to know how to make things better. I think a lot of anger, certainly with how people have responded to dealing with COVID. I know that that's been something I've been working with my colleagues on as well. So just a host of emotions that tend to be difficult for us to manage. And again, if you have anything that comes up for you, fatigue, yes, absolutely. Lonely, absolutely. Anxiety, yep. It's restlessness. Yeah, there was this great article that I read. I can't remember where, but it was talking about just this feeling of being bored and overwhelmed at the same time. And so, bored because we can't do what we want to do, and then feeling overwhelmed. Thank you for those of you who are sharing in the chat box. Appreciate your thoughts. With a difficult situation and emotions that come up, there's also thoughts that are associated with, with what's going on. And one of the things that I like to help people recognize is that there's this worry chain that happens. It's sort of like the snowball effect. You have one worrisome thought, like I'm going to be working in the OR today and I might care for patients who are COVID positive. That often is linked to a more distressing thought. Will I get COVID today? To an even more distressing thought, I'm going to give it to my family. And what if I get sick or my family gets sick? So these thoughts, they tend to snowball. They have that chain effect where we start with one and then it gets worse and it gets worse and it gets worse. And I'm sure you've noticed this in your own times of stress, where things start off like you're just kind of processing what's happening, and then you're at the worst case scenario possible by the end of that. And that's, of course, just brings up more negative emotions and can leave us feeling even more disconnected. So when do we know when our thoughts or our worry is a problem? Like, when is it at that tipping point where it's maybe not helpful? And so if you look at worry on a spectrum, some worry is helpful. My worry about this presentation motivated me to make sure that I got it done on time and that I was ready to present and that, I was here and ready to roll. So some worry, some anxiety absolutely is helpful. It motivates us. Even worry about the pandemic, it motivates us to be careful, to be cautious, to do the things that we need to do. But like with anything, it's like that bell-shaped curve. Once you tip over the hump, then that worry is not helpful. And that excessive worry can be fatiguing. It can leave you feeling demoralized. It can actually get in your way of problem solving and doing the things that you need to do to take care of yourself or to manage the situation. This is a slide that I pulled up because it has to do with burnout and how burnout and stress can influence your cognitive symptoms, poor judgment, which with the type of work that you do absolutely matters. It can lead to emotional dysregulation, physical symptoms. As a pain psychologist, of course, I have to bring up the physical symptoms, right? We do not have a mind-body disconnect, even though we like to walk around thinking that we do. It can lead to, weakened immune system, aches and pains, other negative side effects. And then behaviorally, we engage in activities that are often not helpful. So a lot of self-soothing's been going on with eating and drinking over the pandemic, nervous habits, procrastinating, sleeping too much or too little, maybe pulling away from loved ones, withdrawing. So I put this up just as a reference point so that you have a sense of, how are these things, if they're affecting you, what different domains might chronic stress or burnout be impacting your experience. So when I work with folks on wellness, I like to think of it as 4 buckets, although I will say that there are many more than just 4. But most people know optimal nutrition is helpful. What we put into our bodies makes a difference in how we feel, our energy level, and our overall health. Certainly, I'm sure I'm preaching to the choir here. Sleep is incredibly important. We don't get enough sleep. It's hard to make it through the day. We're irritable. We make more mistakes. Exercise, moderate cardiovascular exercise most days of the week is recommended for just about everything and everyone. So I know that, those areas most people are familiar with, but it's the mind-body health that I wanted to spend a little bit of time on today because it tends to get neglected. It's something that we put on the back burner and we take care of maybe these other things, but we forget that our relationship with ourselves matters. And so I'm here to give you some tips and tricks that you can use to strengthen that relationship with yourself. So my first tip is, and this is going to seem incredibly simple, but I'll explain why it's so important, is to make a list of things that are under your control versus the things that are not under your control. So how do we know if something is under our control? I'm just curious, in the chat box, if someone wants to go ahead and share, how do you know if something is under your control? Yeah, there's an actionable step, right? There's something that you can do about the situation. And so things where you can't control other people, we can't control the pandemic, we can't change things that have happened, but something that is under our control would mean that there is an actionable step that we can take. So that would mean, that's something that would be under my control. Everything else goes into the other side of the list, not under my control. It's important to recognize the difference between the two, because a lot of us spend lots of time perseverating, ruminating, thinking about things that are not under our control. And there isn't an actionable step. So we're just left with the what ifs, the thinking about it, the being upset about it. And we often don't know what to do with that. Like, well, what do I do with something that I can't control? So we're going to talk about that next. So we're going to do a quick little exercise to highlight why it's important to recognize there are things that you can do with managing things that are not under your control. So for the next 30 seconds, I would like you to close your eyes and think about anything in the world except chocolate ice cream. So don't think about, the chocolate ice cream that's starting to melt and drip on a warm summer day, the taste of it on your tongue, that creamy experience. So for the next 30 seconds, go ahead and think of everything except chocolate ice cream. Okay, so I'm curious, what was that like for folks to not think about chocolate ice cream? Was anyone able to? I only thought about chocolate ice cream. I love chocolate ice cream. I would always come back to it. It was hard. Yeah, you guys are spot on. It's even for the people that say, well, I didn't think about chocolate ice cream. I'm like, well, how do you know you didn't think about chocolate ice cream? You have to think about chocolate ice cream to recognize whether you're thinking or not thinking about chocolate ice cream. It backfires. So let's try that again. Let's take 30 seconds and let our mind think about anything that it wants. If it thinks about chocolate ice cream, great. But then just allow the thoughts to come and go. So think about anything that you would like. Just allowing your mind to do whatever it wants to do. Okay, so now how is that, or was that different? Just curious in the chat box, what was that like between the first and the second? It was more relaxing. Yeah, absolutely. Absolutely. What else did other folks notice? You didn't feel guilty thinking about it. Didn't feel stressed. Yeah, exactly. So it's important to recognize how trying to suppress, ignore, deny something can actually become part of the problem. So Anyone ever notice if they get anxiety about their anxiety and then they judge themselves for having anxiety? And they're like, why am I thinking about this? I shouldn't think about this. Why am I thinking about this? And it just becomes this cycle of just frustration and defeat. And so my number 2 tip is dropping an anchor. So what does that mean? Dropping an anchor is tapping into some of the being present in the moment skills combined with letting go. And so our body is always in the present moment, always, but our mind is often not in the present moment. It's either worrying about the future or ruminating about the past. And so our breath is always in the present moment. And so when you think about dropping an anchor, what I'm referring to is connecting with your breath. So I'd like to walk you through a really quick mindfulness, just a taste of a breath meditation so that you can have the experience of that dropping of the anchor. So if you are in a place where you feel comfortable, I'd like you to go ahead and just allow your eyes to naturally close. I know some of you are probably in the middle of eating, so you might have to just take a little step away from your food for just a couple minutes. And just allow yourself to sit comfortably in your chair. Feel your feet on the floor. And feel your body upright. Notice your body's contact with the environment. You can feel your body sitting in the chair, your feet on the ground, the bend of your joints, and the clothes on your skin. And you can just start to pay attention to the sounds around you. And then release your attention from the sounds around you. And gently place all of your attention on the tip of your nose. And begin to notice your breath moving in and out of your nostrils. You can notice the change in air temperature between the in-breath and the out-breath. Gently following your breathing. And also noticing the rise and fall of your belly. And just allow your breath to be natural and unforced. And just follow the rhythm of your breath. And if at any point in time you become distracted, just recognize that this is completely normal. This is what our brains do. Just notice that your attention has been pulled away from your breath. Thank your mind for being so active and helpful, and gently shift your attention back to the tip of your nose. You might get distracted 100 times, and that's okay. Just acknowledge your thought. Thank your mind for being active and helpful. And then gently shift your attention back to the tip of your nose. Noticing your breath. Feel your body. And if anything difficult pops into your mind, try to hold that with compassion, acknowledging that there are difficult things that you're dealing with and that you're doing the best you can. You might even say to yourself, I know I'm doing the best I can. And if it's hard for you to find that compassion toward yourself, you might think of a loved one and what you would say to them. The love and compassion that you would give to someone that is near and dear to your heart. And then you can take that and return it to yourself. And then just following your breath again. You might even start to notice how the air feels on your skin, how that's different from how your clothes feel on your skin. Just noticing, just observing. And then you can release your attention from your breath and allow your attention to expand back into the room, listening to the sounds, feeling your body in the chair. You might even imagine what your room will look like when you open your eyes. And just taking a moment, before you open your eyes. And then when you feel ready, maybe on your next out breath, you can just allow your eyes to naturally open. So that's just a very, very brief dropping the anchor exercise, connecting with the breath. I think there's a lot of talk about mindfulness meditation and, do you have to sit 45 minutes and, to get benefits? And I like to think of dropping the anchor as a way to just ground yourself in the present moment. Because oftentimes in the present moment, we actually are safe and we are okay. And it's our mind that's kind of spinning us and getting us into a space that is not helpful, right? Maybe we've tipped over that bell curve and we've moved into an area where our excessive worry or our unhelpful thoughts are affecting us in a very negative way. So I like to use this dropping an anchor, 3-minute exercise, 5-minute exercise when I go from patient to patient, so that if I have a really difficult interaction, I'm not taking that interaction into my next appointment, or at least I'm aware of what's happening enough that I'm not going to then react to it. And so I hope that, this is something that you can use, quick, easy, dropping the anchor to be present and then to let go. And remember, letting go isn't trying to control or change. You're not analyzing your thoughts. You're not trying to change them. It's not the catch it, check it, change it CBT model. This is the noticing it, back to the breath, noticing it, back to the breath. You're noticing it, but you're not chasing it. And if you're not chasing it, it's less likely to hijack you emotionally. I like this quote: nothing can bring you peace but yourself. I think sometimes we forget that we have the power within ourselves to bring ourselves peace. We also have the power within ourselves to completely ruin our own day and get us completely worked up and beat up on ourselves and engage in all that negative self-talk. So it actually is a choice. And so I just want to remind people that I know that you have that ability. Certainly, if you can give compassion to others, then you have that ability, and then you can cultivate that for yourself. My third and last tip is to create connection. So one of the things that I've become more aware of working with our medical fellows is understanding this conspiracy of silence that can happen within the medical community, and probably many other communities as well. But it's this: everyone else has it figured out, and my suffering, I need to keep quiet. I need to fake it till I make it. I can't tell anyone, I can't reach out, and how dangerous that conspiracy of silence can be. And so when I'm talking about creating connection, I'm referring to connection within your work community. So social support at home obviously is incredibly important. But of course, you should keep, cultivating your relationships in your personal life, but this is more for your professional life, connecting with people that you work with, or, similar professions, so that you have a safe space where you can be authentic with your experience. You can show up in a genuine way and get support. Oftentimes, if you're struggling with something, I can guarantee you other people around you are struggling too. And there's this sense of community that you can build. I know one of the talks I was listening to was talking about the importance of mentorship. And this would be similar. This would be building those relationships around your emotional health, and having that sounding board. I know I've reached out to Dr. Tofik, I don't know how many times, when I'm feeling a certain way and just wanting to talk with a trusted colleague on what's going on, help me get some perspective, and also help me realize that I'm not alone in this. I'm not the only one that's struggling. And I found that to be just so incredibly important. So here are some questions that I thought I could put up just to get you thinking about this. So these would be connecting with yourself. So again, that mind-body health, that relationship that you have with yourself, connecting with others, your colleagues, and then of course, compassion, because I think that's something that we're all missing out on a regular basis. So who do I have in my work life to connect with? Who would be a safe relationship for you? And trying to nurture that relationship. But first you have to identify it. And maybe you already have someone, or maybe you have someone that you're connecting with and it's not healthy and it's not helping you and you're not getting what you need. And you can think about that as well. What does self-compassion look like for me today? So, so one of the things that I would want to ask each of you every day if I saw you was, how are you showing up for yourself today? Like, what are you doing today that would be compassionate? What would that look like for you? Maybe it's, making sure that you do your exercise, or maybe it's that you cancel something so that you can focus on yourself. I don't know what it would look like for you. Maybe it's dropping an anchor, 3 times a day. And then sometimes it's helpful to go back to our values of, why did I become a physician in the first place? Like, why did I choose this profession? This is really helpful on days that are really difficult, where you're just like, I hate my job. I don't know why I'm doing this. Nobody appreciates me. Coming back to, it's not about them. It's about you. It's about your value, your internal compass of like, why did you choose to do this with your life? What was important to you? Because what was important to you then is still important to you. And then how can I demonstrate compassion for others? So connecting to your values as a physician, and then thinking about, how can I demonstrate this in my behavior? Like, am I demonstrating it in my behavior? Am I demonstrating compassion? What does that actually look like? How would you quantify that? How do you know if you're being compassionate? So I hope that these questions will be helpful to you. And so finding peace in the storm, we don't have control over the storm. We have no control over the storm. The pandemic, right? It's here. Hopefully things are getting better, but it could be the pandemic, or this just could be situations that happen in life, difficult situations that happen. A lot of it is not under our control. The only thing that's under our control is what we do. So things that can help you to find peace in the storm would be acknowledging your thoughts and feelings. They're not the enemy. The struggle with them, I would say, is maybe part of the problem, but the thoughts and feelings that you're having aren't necessarily problematic in and of themselves. come back to your body, come back to your breath, drop that anchor, and then connect and engage. So connect with yourself, connect with others, and then engage fully in what you're doing. Finding that meaning and purpose in your life, in your work, and really thinking about how to bring a compassionate lens into what you're doing, specifically around the relationship with yourself. Again, I think we're all good at being compassionate toward others, but it's that self-compassion that we tend to struggle with. I wanted to leave you with some resources. So Headspace and Calm and Insight Timer are some apps that you can download. They've got different types of mindfulness meditation, or different types of meditations. I think Headspace and Calm may have a fee, but I know Insight Timer is free. And then I put some self-compassion resources. So selfcompassion.org is Kristen Neff. She's a big guru in the field of self-compassion, as is Chris Germer. So they both have their websites there, and they have free meditations and lots of resources. Tara Branch also has a really nice website, so I put that up there as well. And then some coronavirus resources, which may or may not be helpful, but I just wanted to add those in. All right, that is. See if I missed
Thank you
anything.
so much, Heather. I think for some people, this is pretty new. Not everybody has the opportunity to work with pain psychologists on a daily basis. So it was really helpful to hear your insights. And honestly, even though I've heard some of this before, it is always a reminder that it is easier to show compassion for others than ourselves. And it really does take requires us to think about it. And I think, as Lauren said in the chat, that example of like, think what you would say to someone else in that situation and then turn it back on yourself. That seems easier than just trying to turn it on yourself to begin with. So I think it was really appreciated. And maybe some of these websites can be sent out. I think there's going to be a post-meeting email. So maybe some of this can be included in that as well. So thank you so much. I think we may just have a couple of minutes if anybody has a question in the chat or or wants to unmute and ask a question. Otherwise, I think that Lauren and Kristen have a schedule to keep us on. And,
yes, I was mindful of our time, so.
No, Heather, we appreciate you coming and joining us and sharing that with us so much. That was an incredible presentation.
Oh, thank you. And, I just want to put that out there that, I can be found at hking@stanford.edu. If you guys have questions, comments, reach out. I'd love to be a resource. So I really appreciate the time. Thank you so much for inviting me here today. And yeah, it's been fun. If we were in person, I would have brought chocolate ice cream. I just want to put that out there. So.
And Heather, can I bother you to answer one quick question that I just saw in the chat, which was from Brittany, and she says, how do you feel about devices telling people to breathe, such as the Apple Watch?
Yeah, I mean, I think we love our devices. Here in Northern California, we love our devices, right? I get this question all the time because I do biofeedback, and everyone's like, well, should I get a home app? And I'm like, well, I think reminders can be really helpful if you're not sort of cultivating that sense yourself. I don't want to be reliant on anything to tell me to breathe. But then again, I'm sure there's times where it could be really helpful, so I think it really depends on, if you're finding it difficult to take those breaks, like maybe the Apple Watch is helpful at work, but you don't need it at home because you're more relaxed and you're more in tune with how you feel. And so, I think you have to look at where you're at in your practice of self-regulation and acknowledging your needs. And reminders can be incredibly helpful in environments where you're less mindful, which is usually when you're multitasking, which is usually at work. So maybe you kind of pick and choose when you might need that. And if you find it helpful, if you start ignoring it, then that's probably not, not going to be helpful. Thank you for that question.
Thank you so much.
Yeah, thanks.
And thank you for your time this morning, Dr. King, and Lauren and Kristen for the invitation, and we will hand it back off to you.
Guys,
everybody.
we're going to take a very quick break here, guys, 3 to 5 minutes. We'll come on back and start talking about funding.
Everybody wonders what anaesthetists do while the patient is asleep. Everybody wonders what we do for 3 hours while that machine goes beep. Everybody reckons we drink coffee and we gossip and we're generally subversive. Everybody reckons we do crosswords and Sudoku and we chat up all the nurses. Really think that's all we do? Well, let me tell you now, it isn't true. 'Cause we sometimes check the screen, and every now and then we write stuff, and if we have to intervene, we inject a bit of white stuff, and we offer to alter the lights, or the height of the bed, or fiddle with the radio, change the CD. We even check the patient occasionally. And if they move, we turn up the vapor, and then we go back to reading the paper. 'Cause when the patient's asleep, we just sit and listen to the beep. We just sit and listen to the... Once upon a time I took pride in my job, but now I think it's time to depart. 'Cause I just sit here every day and listen to blips of the heart.